Okay, so the next speaker is Lynn Haag, and Lynn is going to be talking about the intersection between intimate partner violence and brain injury. So this is one of those situations where we're going to get some information and discussion about the long-lasting impacts in a particular area. She's going to talk about the work that she's doing. She is a PhD candidate and contract faculty member with the Faculty of Social Work at Wilfrid Laurier University, and a research trainee at the Acquired Brain Injury Research Lab at the University of Toronto. And as I said, her research explores the intersection of intimate partner violence and brain injury. So, Lynn, thank you very much for being with us here. And I'm sure sometime soon in the next few months, I'm not going to jinx anything, but look forward to calling you Dr. Haag. But go ahead.
Thanks very much, Robin. Yeah, please don't jinx anything. But all things considered, it'll snuggle up to that Christmas decoration you have going on behind you, Amy. So it should be about the same time of year we can all celebrate something together. And I just want to say thank you very much for giving me the opportunity to speak today and come together with all of my colleagues here and talk about something that we really don't talk about very much. And is really, it ties into what Christine sort of started off by saying this is this ongoing condition that can really have an impact on folks for a long time. So I'm just going to follow the advice here and set a timer so I know what I'm doing. I think the sort of the thing that I really want to point out to folks is how this happens, how often it happens, and then leave you with a quick glance at something that we developed to support folks. So I talk about the perfect storm effect. And what I'm referring to there is that we know that the most likely form of physical violence in an intimate partner violence encounter, over 92% of assaults will include hits to the head, face, or neck, including strangulation. And the most likely type of injury to be sustained after that kind of assault, short of broken facial bones or surface bruising, cuts, and abrasions, the most likely type of injury to occur from that kind of assault is an injury to the brain itself. Quite similar to what folks might think about in terms of concussion injury or car accident, folks who've been through a car accident who might suffer a mild to moderate traumatic brain injury. And these injuries can come both from physical hits to the head, face, and neck, but they can also come from strangulation as well. The most likely type of resultant damage to the brain would be in very specific areas. And those areas would be the sorts of things that control, in many cases, control the executive functions. So when we talk about executive functions, we're talking about things like planning skills, organization skills, the ability to multitask, decision-making, emotional stability, impulse control. All of those kinds of things are controlled by the areas of the brain that we would expect to see damage in with that kind of physical assault. And the sort of the piece that plays in for that that's really, I think, is really critical is that if you think about all the things that are needed in order to plan and execute an exit strategy safely and effectively for women, in many ways, these skills may very well be part of that, those sort of necessary skills in order to be able to do that. And they may very well be cognitively, physically impaired in a way that almost nobody that she's going to come up into contact with is going to understand, recognize, and know how to support. So for these women, really what we're seeing is a lack of awareness in the community, in the healthcare community, in the IPV support community, traditionally, in just about any context that you might think that they might be finding themselves in. That is changing. We've been doing this work now for 8 to 10 years. And I'm very happy to say that the needle is moving. You know, I personally have had the opportunity to speak with a couple of organizations locally. I support our brain injury organization locally doing some IPV work. So we are moving the needle, but it's like everything, it's painfully slow and we've still got a lot of work to do. The second sort of piece of statistical information that I like to give folks is I think one of the most shocking parts about this, and that is just how often does it happen. And the reality is that the research that we have to date, which is very minimal, but the research that we have to date suggests that up to 75% of all women survivors of physical intimate partner violence have probable brain injuries as a result of that exposure. So when you just go back and do a quick calculation on that, if you think about Christine's or Jen's number, about 1 in 3 Canadian women can expect to experience intimate partner violence over their lifetime. If I take 75% of those women and calculate that out, I come up with 1 in 8 Canadian women have probable brain injury as a result of exposure to intimate partner violence. And I think the aside from the fact that that statistic is shockingly high, the piece that always sort of comes home for people is that 1 in 8 is the same statistic as breast cancer in this country. So we're talking about the same percentage of the population are experiencing probable brain injury as a result of exposure to violence as are experiencing breast cancer. And I think one of the reasons why I really like to bring that home for folks is that if you just take a second and think about all the things that we know about breast cancer, all the research that goes into it, all the funding dollars that go into it, all the support systems we have in place, the diagnostic, the treatment, the lack of stigma attached to breast cancer, and none of those things should change. So I'm not saying for a second that that's a bad thing, but all of those resources and supports and options, none of them exist for this particular group of survivors. So I think, one of the things that I do, I take absolutely every opportunity I can find to have even, the quickest of conversations around this particular intersection, because I think I agree entirely that education is the way forward. If we can get folks aware of the intersection itself at all, and then start training the frontline workers, start training medical care to recognize, to have a sense of what are the next steps, where do we go, how do we support, what do we do? I think that's where we can start to move forward and change this. And for me, while I wouldn't say that intimate partner violence is only a healthcare concern, because I think too often we like to nudge things into healthcare and then they get lost in a bigger conversation. So I'm careful about that. I certainly would argue that this is absolutely partially a healthcare issue, and that until we reframe it that way, we really aren't going to see a lot of movement. So I think that is a very important conversation to be had. And I'm very pleased to be able to bring that today. The other part that I would like to be able to do is just to take a quick minute and show you something that we built at the research lab in Toronto. And that is a toolkit, an online web-based toolkit that we designed to support frontline workers in their efforts to recognize traumatic brain injury amongst their client population. As well, we've now expanded that into other sectors and other contexts, because we've found that a lot of folks were coming to us from the healthcare perspective. Particularly, we've started work with legal professionals as well, trying to just, again, raise awareness, but also to be able to give you some tools in what to do. You can find this at www.abitoolkit.ca. It's freely available. All the resources on here, they're free for you to use. You can download them, you can share them. We talk about using the toolkit as a sort of a means of communication for folks when they're working with somebody who's a survivor who they think may or may not have a brain injury. Oftentimes we feel, we hear from frontline, I don't want to diagnose, that's not my job. And my response to that is absolutely not. And I don't need you to diagnose. I just need you to be aware of the challenges that this woman might be facing that will be interfering with her ability to access the services that you're actually providing. So one of the analogies that I give folks is, if you were helping somebody who had to use a wheelchair to walk, you wouldn't ask her to stand up and cross the room in order to be able to talk to you. And what happens, unfortunately, is that when you try to communicate with someone who may have cognitive impairments and you're not aware of them, the conversation that you're having isn't going to get through effectively, because there are challenges and barriers to that communication process that you're just not aware of. So if you sort of think about that wheelchair and walking kind of picture, it translates into what I'm talking about here. So just a really quick sprint across the toolkit, you can see that we have here the traumatic brain injury section. So if you click on that, it takes you to the traumatic brain injury section where you can then get all the information that you might need about traumatic brain injury, what are its signs and symptoms, what are the effects, what does it mean to have repetitive exposure to them, things like that. We have a glossary of terms, sort of basic stuff like that. Then for folks who started to come to us from different sectors and say, you know, we needed intimate partner violence information, we figured out how to provide that for them as well. As well here, because we're not intimate partner violence specialists, we're brain injury specialists, we felt it was really important to link out to projects that could provide that kind of specialized intimate partner violence piece. So those are here as well. This section on supporting survivors was specifically designed for frontline workers. And we thought about all the sorts of conversations that were really important. What did you really need to understand about brain injury and about this particular group of survivors in order to be able to adequately support them? So we have lots of different conversations here as well, including where might you refer and what might that look like. So we actually give a detailed description of, well, what is an occupational therapist? What do they do? And what might that look like for support for a survivor? You'll see on the far right over here that there is a section on, if I do this, I think I can move that out of the way. There we go. There's our resource library. That's a new addition in the 2.0 version that we have here. It was updated earlier this year. And you can see we have a video library here where we have lots of short videos on various topics, including the snowball effect, which happens to be a video comprised of firsthand reports and comments that was gathered during research processes. And those are from survivors and frontline workers themselves. So we wanted to provide their voice and give them an opportunity for them to tell their stories in ways that were meaningful. So we put that one together as well. You see here, you can have access to all the latest research. We have downloadable information sheets that you can print and take away. You can use in your own organizations, whatever works. And then here at the bottom of this, for every province in the country, for every province and territory, we have various brain injury services. So just as a general trick, we'll see what happens when we click on Kitchener. And of course, what'll happen is services that exist won't be there, because that's always what happens when I run this little test somewhere. But now if you scroll down, you can see here that there are various brain injury association options for support. So we at least tried to provide somewhere for everybody to be able to go to have a look and see what was local to them, so that folks on the front line would have a sense of what might be available in your community. When the last thing that I want to sort of touch on, and that is that one of the things that I get asked a lot is, well, what can we do in our organization? And the answer really is, you can do a lot with very little cost involved. So you can change the lighting in your organization so that you've got a softer lighting. Make sure that when you're talking to survivors, there's minimal amounts of noise and background noise and distractions available to them. Have conversations that are short and to the point. Make lists, help them with memory functions, that kind of thing. And I think those sorts of things, they sound like they're these little tiny things, but they actually can make a big difference in the lives of these women. And I think it's important we have a lot of those on the toolkit. You can find information like that. And so you really have at your fingertips there a chance to get as educated as you need to be or want to be. You can read all of the articles that I've read up to date. As well, you can just skim across the top and find out, I've got somebody who's coming in that in 5 minutes, and all I have is 5 minutes to sort of get a quick answer to something, and that's there too. So that's what we try to do, and I hope that it's helpful for folks. If you have questions or you need help with it in any way, please reach out, and I'm around.
Okay, Lynn, thank you very much for that, Lynn. And certainly, when we talk about brain injury, it's that it's like that unseen. You don't really see someone with a brain injury. It's like depression. You don't see depression, or pain. You don't see pain, but scars you see, other things you see. And so it's so important to recognize that there is a large unseen injury here that you're dealing with, and to be attuned to that. One of the things we talked about, which I thought was interesting, because when we were having conversations prior to tonight, we talked about those situations where, hockey players or football players, their brains are donated to a brain bank and examined or whatever. You mentioned something about, was it the pink brain
The
bank?
pink brains, yeah.
Could you just tell us a little bit about that?
Well, it's part of the challenge with repeated exposure to brain injuries, and we see this in football players and in soccer players, hockey players. The disease that was being referred to as chronic traumatic encephalitis, CTE, and it's repeated exposure to very significant head injuries, and it causes a sort of an early onset deterioration that can end in violence and self-harm and suicide. So it's been in the news for quite some time, and there have been brains from athletes that have been donated, because unfortunately you can only diagnose this post-mortem, so after death. And so they were doing a brain bank of male athletes to be able to get more evidence and more information on this. And those of us in the IPV brain injury research field were obviously interested in this particular issue. Most of us would say we would expect to see some kind of similar condition. What that's called, what it looks like, we don't know. But we've recently been able to start up a pink brain pledge, where we're looking for women survivors to make the pledge to donate their brain to these very specific research organizations in order to be able to follow this up. So it's very, very early days. I think we've had 2 or 3 perhaps to do original study on. There's very little information out there, but we are starting to look. And if you were interested in the Pink Brain Pledge, you could find it at pinkconcussions.com .com. Pink Concussions is an organization in the US that is interested in women's experiences of brain injury. And there's a specific task force on partner inflicted brain injury that we started a few years ago. And it's through that organization that the Pink Brain Pledge can be accessed.
Okay, great. Thank you very much for your comments and presentation.